Hello, Dave Nassine here, giving you a little rundown on how I look at the cervical spine CT. So I start on the sagittal images, and as I scroll through, I start to look at C0, C1, occipital condyle C1, C1, C2, all the facet joints. I'll scroll back and forth until I've seen them all, taking note of some spurs here, nothing too terrible, but everything lines up and there are no fractures. Looking at the spinous processes and lamina as I go across the midline, everything looks okay. No major abnormalities of alignment, no fracture. Continuing over to the other side, I look at C0, C1, C1, C2, and again scrolling through all the facet joints. And sometimes you got to go back and forth to make sure that you can see them all, but I definitely go down in order to make sure that I've seen everything. I go back to the midline, look at the clivus coming down, the relationship of the skull base to C1, 2, and make sure that everybody lines up both anteriorly and posteriorly. Looks good. Also looking at the vertebral body heights and potential for compression fractures, everything looks good here. Also a great opportunity to look at the prevertebral soft tissues. Should be very skinny up top, should thicken up as you get down to the esophagus, but everything looks within normal limits, and what we see of the airway looks perfect. So on the coronal images, I basically focus on a couple of different things. Mostly the craniocervical junction, so occipital condyle C1, C1, 2. These occipital condyle fractures can be pretty sneaky, and this is a great way to see them. Looking at the lateral masses, you can see that they all stack up well. No abnormalities there, no fractures. This is another good way to look for the posterior rib fractures that you sometimes see with bad injuries. So it's another way to see them, and sometimes they're more apparent than on the axial images. So now looking at the axials, scrolling down from the top, here's the skull base, there's the occipital condyles, C1, there's the dens, so C1, 2 interval is totally normal. Now we're also going to be looking at the neural foramina, the transverse foramina, because the sagittal images don't show you those fractures very well, and they do put the vertebral arteries at risk. So looking at these anterior and posterior tubercles, which are other places that cervical spines get fractured, everything looks pretty good here. We do have some degenerative osteophytic spurring here at the uncinate processes. Not terrible. C7 a lot of times has this little rudimentary transverse foramen, but usually, as everybody knows, the most common place for the vertebral arteries to enter the cervical foramina is at 6, but sometimes they can enter at 5. So now we do get another chance to see these upper ribs, and they look fine. So that's basically it for the bones, and now I'm just going to go and look at the soft tissue windows just to make sure that I haven't done anything crazy and missed something silly. So this is another great chance to look for epidural hematomas, which are generally pretty bright, but this is coned down pretty tightly, so we don't have to look at a lot of things, which is kind of good sometimes, but we're looking for enlarged lymph nodes, we're looking for thyroid lesions, and that kind of stuff. We do get a crack at the lung apices, which are probably better seen on the bone reconstructions, but one more chance to find some pathology. Many times you will see the tippy top of a pneumothorax in a trauma patient. So that's about it for how I do it. Thanks.